My clinical case study was focused on post-traumatic stress disorder. So there are many types of disorders that a human can endure, but one of the common disorders is post-traumatic stress disorder. PTSD is a disorder that can develop if an individual has seen or lived through a shocking, scary, or dangerous event. People often think that PTSD can only occur for people that are in the military or in the army or in the corps or anything like that, but it can really happen to anyone that has maybe endured a traumatic life event within the family, like a death or a car accident or some sort. PTSD is obviously the acronym for post-traumatic stress disorder, and one can be diagnosed for it if they have it for longer than 3 months. It causes distress or disrupts their work life, home life, or any daily tasks that they do. So if their normal habits are getting into or are changing, and it's not the same pattern while they have PTSD or they've gone through some traumatic event, then you can start to notice the symptoms. Some of the symptoms are reliving the event, avoiding situations that remind you of the event, negative changes in beliefs, feeling alert or paranoid, decrease in sleep, and much more. Some health provider for people with PTSD are psychiatrists or therapists that work with people who have PTSD. Psychiatrists and psychologists often try to stay away from medication, but if it is necessary, they could prescribe serotonin reuptake inhibitors like SSRI, Zoloft, or Paxils to make them feel better. And these are all FDA approved as well. So some of the therapies that a client or patient can go through is psychodynamic therapy, cognitive behavior therapy, or emotion-focused therapy. There are many types out there, but they can take any therapy from a psychiatrist, psychologist, therapist in order to make them reach make them feel better and reach the norm that they were at before the accident. They might relapse or some sort, but just to get them anywhere closer to back to the norm. A client, if under a therapist, would be treated for a few sessions a week depending on the severity of the PTSD. The nature of the person would determine the nature and duration of the treatment given. One would have to look at the symptoms, how long these symptoms have been occurring, whether there was any harm done to the patient themselves or to others. Depending on all these factors, the treatment and duration for the sessions with a therapist or a doctor could differentiate. And of course, the doctor is mentioned because, along with healthcare, a psychiatrist, a therapist, or whatever is not the only thing that can be given to this patient or client. Obviously, if they harm themselves or if they are having any distress, they can also go to a doctor and receive help if necessary. So this was my clinical case study and the disorder that I chose. Thank you.